Well, here's a case that really quickly that I was referred, and again, just to kind of hone in on whether or not to graft or not to graft at the time of tooth extraction. It's obviously a big point of contention. This was a case, and it was an old patient of mine sent me her I think it was her niece. And, over the phone, I'm talking a big game. Oh, don't worry. I do this all the time. Come in, I'll take it out. We'll put the implant in the same day. Come to find out, she's a professional soccer player, the niece. And this occurred years and years ago, probably when she was about 8 years old. And it was just one of those things that, this girl's life is soccer. She's never taken time off to get this fixed. And it just went on until she finally, was forced to come see me, because it's just obviously breaking down, separating everywhere, and very, very large defect. And to me, this extraction obviously only takes a couple of minutes, but, debriding this and being able to maintain that bridge of bone is so, so critical here.
You're better at maintaining that bridge of bone than I am.
That's something I'm good at, is maintaining that bridge of bone. And honestly, I do use some of the tricks that you've showed in our courses, because, I used to use that spoon like your brain wants to use the spoon. Yeah. And rather than doing that, what we'll do is, and I learned this from you, Israel, is to kind of peel it using the back end of that spoon. So peel around the defect. And what that does is it allows you to pretty much remove, the vast majority of that defect in one big mass, as opposed to once you sort of tear it, now you're going down the rabbit hole and you can never really get it clean. Yeah. So that's critical here. And in this case specifically, what I'm going to be doing here is grafting at the time of the tooth extraction, because I was pretty confident. I had great access now that I had to open it. And we used a sugar crossing collagen membrane, just a little stabilizing suture. But again, this is a pretty simple defect now that we have it clean, because it's completely within the housing of the bone as well. So despite the large, nature of the defect, completely within the housing of the bone, and we just re-entered this about a month ago, and I was very happy with the stability of the bone there. So when I sent this picture to Israel, you remember what you texted me back?
Yeah, I did. I believe
my bone grafts come with their own osteotomies, I think.
Yeah, that's exactly it. I didn't realize that you'd placed the implant there. So I was like, why is there already an osteotomy like that? That's just not fair.
That's how good I am. All right. So the key here is degranulate. And if you can't see what you're doing, like I did in this case, I'm okay opening it. Even though we talk so much about, atraumatic extraction, atraumatic flaps, but you really have to make sure that you're degranulating. If you do that, then you have great blood supply and you can certainly achieve very, very predictable results. But that's a case where you're dealing with a defect within the housing of the bone.